I had a lump on my breast for nearly 2-3 years. It didn't hurt, so I never bothered to get it tested. Then my right side started aching, and doctors diagnosed breast cancer. They referred me to AIMS. I was alone and faced a lot of problems at AIMS. The doctors would call me for chemotherapy once every 3 months. However, I would land up every month and lie to the doctors that I had a monthly appointment.
With little support from government hospitals, patients like Sadhna turned to organizations such as CanSupport for information and compassionate medical and emotional care. CanSupport specializes in palliative care or pain relief for cancer patients where treatment options are limited.
I was admitted to the ward for a surgery. I was hungry the first day. The second day also, they kept me hungry, but didn't operate. Third day, I fought and asked to be discharged, saying I didn't want to be operated. When I threw a fit on the third day, the doctor operated on me. They kept me admitted for months before the operation and then discharged the patient on the same day of the surgery, regardless of the patient's condition. I was also discharged.
But 8 days later, Sadhna was back at the hospital with an infected open wound and knew almost nothing about the treatment that was being administered to her.
Our doctors in government hospitals have to, I feel, be trained in good communication. They have to be trained in how to break bad news. They have to understand that they're dealing with a person and not just with a tumor. You know, that shift has to take place. It hasn't happened as yet. And unfortunately, in our society, because of the gaps, the socio-economic gaps, and the fact that people who are in these hospitals, often without thinking, are very judgmental when it comes to those who don't have the same level of education, the same economic background, are often not willing to share information with people.
The biggest problem is that people don't get chemo education. And they do not get good follow-up care, and also the dressing changes are done very haphazardly, and I think in general it's the follow-up. There is no follow-up care. They give chemo, they write all these things, but nobody explains to these patients what's really going on.
Besides the lack of information and struggle to pay for treatment, cancer patients at government hospitals get little help in dealing with psychological and social effects of the illness.
I got all the work done from the hospital, but some days I wish there was someone with me to face all this.
We try to make them live in dignity, no matter what the diagnosis is. And we give them lymphedema garments, we give them prosthetic bras, and we also we give them, of course, diapers, we give them wigs. We just want them to have a dignified, happy life.